So we're going to look at simple exercises we can do at home which will help strengthen the muscles in and around about the knee. So we're going to be using no equipment, just anything you can do at home. So quickly, first a little look at the knee. So the knee is a complex joint, but its function is reasonably simple. It's just to provide movement between the top of the leg and the bottom of the leg. It's what we call a modified hinge joint, so it can really only do that movement there. When we look at the muscles connecting into the knee, we have at the front of the leg, we've got the quadriceps, and they connect into the kneecap or the patella, and their job is to extend it out or straighten the leg. The hamstrings connect down either side of the knee, and their job is to flex it out or bend the leg using the hamstrings. We do bring in some sort of function through the glutes as well. But those are the main muscles that are going to affect the knee. If we look at the knee, a little bit of the anatomy of the knee, simple breakdown, we have some ligaments in there. So the knee is held together by certain ligaments. So we've got the anterior cruciate ligament and the posterior cruciate ligament. There, if you looked at it in the diagram, you see them in between the kneecap. Their main function is to stop the knee sliding back and forward. To the outside we have the lateral and collateral ligament, and the inside we've got the medial collateral ligament, and their job is to stop the knee moving side to side. In the middle we have a meniscus, which is basically a cushioning pad that is in the middle of the knee, and that's like a shock absorber to absorb any shock that's coming in through the knee. So what sort of things can go wrong with the knee? Osteoarthritis is a typical thing that will happen. Osteoarthritis is a progressive condition that will gradually get worse. It generally affects the joints and the cartilages, and we can end up with little bony deposits as well in and around about the knee area. It's likely to start around about middle age. If we look at other arthritis, we've got rheumatoid arthritis, which can affect any age, and it's an inflammatory condition. You can also get post-traumatic arthritis. I had to think about that one. Post-traumatic arthritis, which can occur years after you've had an event in your knee. For instance, you've torn the meniscus. Years later you can develop arthritis because of that, or any kind of damage to the kneecap can result in arthritis further down the line. Damage to the meniscus can happen, usually through sports injuries, but it can just through wear and tear end up damaging the meniscus. We've got, as I mentioned, the ACL, anterior cruciate ligament, and the posterior cruciate ligament. Much more common to damage the ACL than the PCL. And that's normally, again, it's done through sports, things like rugby, sports that involve fast turning. The LCL and the MCL likely to get damaged in contact sports like rugby, again, when you get that side impact. We're going to focus today mainly on arthritic conditions. So things that may be happening to you at the moment, so knee pain that's been derived through arthritis. It could be that you're currently waiting to get a knee replacement. You're obviously going to have to wait quite a while in the current situation, or just before this all happened you got a knee replacement and you've not had the opportunity to go to physio. So our main focus on the exercises we're going through is looking at exercises that you can do at home, going to help strengthen the muscles of that support the knee, and hopefully get back further movement and keep the muscles as strong as possible. Done these exercises, always do some form of warm-up. So it could just be sitting in the seat, just moving the legs. Get the heart rate up, start to get the joints moving, slide the leg in and out, spend a few minutes just warming up before we start the exercises. So the first exercise we're going to start with is a leg raise. Now, depending on your chair, you may want to sit all the way to the back of the chair, so as long as you're nice and upright. I'm going to sit slightly further forward. I'll turn the chair to the side. With this, I'm sitting forward, and the first thing I've got to do is make sure that I engage my core muscles. So think of something that's about to punch you in the stomach. You're going to engage those core muscles. I'm going to take a grip of the seat at the side, and basically we're going to come into raising the legs. So it's up for 1, 2, 3, hold. I'm going to squeeze really hard into these muscles here. So that's the quadricep muscles at the front, and then slowly lower down. So again, we're going to come up, hold, slowly lower down. So it's that up for 1, 2, 3, hold for 1, 2, 3, slowly lower down. So we repeat that 10 times on each side, and you can gradually increase that as the weeks go on. So we might start with 10 each side, look to increase that between 12 and 16, and then as your leg gets stronger, you can look to increase that again. There's another exercise we can do that's very similar, but what I'm going to do is I'm going to use the other leg as a resistance. So I'm going to bring one leg over and cross it in front of the other. Now I'm not actually looking for movement here, so what's what we call an isometric movement. I'm going to push hard with this leg, but keep that leg where it is, so that leg's stopping this leg moving. But I am pushing hard into here, so these muscles are having to engage. And I'll probably hold that for about 5 seconds and then just release. So again, push, hold for about 5 seconds and just release. So again, I'm going to repeat that about 10 times on this side, 10 times on the other side. So the main focus there is we're working into the quads. The next exercise I'm going to do is I'm going to move into working into the hips. I almost forgot that one. I was going to do a hip one as well. So again, seated here, nice and upright, muscles engaged. We're going to raise up, so more into the hips and hip flexors. Now it's not directly related to the knee, it's all interconnected, so we need to work in these muscles as well. Quite often when we're waiting for hip operations, or we've started to get a degenerative thing like arthritis, we forget to work these muscles. So up again, 1, 2, 3, slowly lower down. Up again, 1, 2, 3, slowly lower down. And it's that slow pace that we're looking for. We don't want to be rushing through it. Okay, once I've done 10 on this side, I'll repeat on the other side. I'm going to move on to an exercise more for the hamstrings. And we're just going to do leg curls. Nice and upright, brace into the abs again. Curl the leg up towards the bum. Make sure the knees stay in line. So a common mistake here would be the knee would come forward. Try and make sure the knee remains in line with the other knee. Bring that as high up as you can. Just be a little bit careful here that you don't get cramp shooting into the hamstrings. If you've not been moving about, you've been sitting a lot, you may find as soon as you do this exercise that you start to get cramp into the hamstrings. So again, our rhythm is going to be up for 1, 2, 3, hold for 1, 2, 3, and lower back down. Making sure we keep these knees in line with each other. So next one we're going to move into, I'm going to come into a basic sit to stand. So sit to stand, shuffle to the front of the chair. We're going to be working the quads and the hamstrings and the glutes in the sit to stand. Need to reach forward, so I'm going to extend forward, drive up, nice and upright, and then come back down. So as I reach forward, drive up, reverse and back down. Make sure you get a sturdy chair for this one, nice stable chair. And if you're not 100% sure, you'll reach back just to feel where that chair is before you come back down. So reach up, and it's hinging at the hip, so we're going to come back down. We can make this slightly harder if we come up, rather than sitting all the way back down, just touch and go. touch and go. We're probably again looking to do about 10 of these to start with. So I'm going to move to the back of the chair, move further down, and we're going to move on to the calves. Again, not directly related to the knee, but we need to keep the calves strong because they do some function into their knee movement. Push high up onto the toes, hold at the top, slowly lower back down. Push high up onto the toes. And we're going to keep that same rhythm going again. So I'm going to come up for 1, 2, 3, hold at the very top for 1, 2, 3, lower back down for 1, 2, 3. So that's coming up for 1, 2, 3, lower back down for 1, 2, 3. Okay, the next one, I've got a little step here. How to a bathroom step. You could use something, a couple of sturdy books. Make sure they're hard. You could use a couple of books to stand on. Again, I'm going to use a chair for support and then come up onto the side. And all we're going to do here is going to drop down onto the floor and back up. So we're working into the glutes and the hip muscles and a little bit into the quads. So it's down for keeping that rhythm, making sure we can brace through the abs nice and upright. Drop down for 1, 2, 3. Come back up for 1, 2, 3. Down for 1, 2, 3. Back up for 1, 2, 3. If you got a nice little step like this, we can also use it for step ups. So just going to step up, up, and then down, down, up, up. If you don't have a step like this, the bottom step of the stairs will do. Or again, if you've got a couple of books, but make sure the books can't slide about. You might want to place them up against the wall. So step ups, step downs. I'm going to move back to the back of the chair and we're going to look at a one-legged squat. Sounds ambitious. We're using the chair here. Also going to use one leg for support on the ground. As we come down, we're going to squat down this, just a very shallow squat, and then come back in. Come back, shallow squat, come back up. So I'm using support in the chair, I'm using support in this back foot. I'm just going to slight bend it into that knee. Again, keep the chest up, keep the abs braced. And then we'll swap it onto the other side. The last exercise I'm going to bring in is just the lunge. So the lunge, what's really important is that we take a long step. The back foot is raised up. So the back foot is up on the toe. This knee, so we've got plenty of room for this knee not to move. I'm going to sink down the way. You see this knee doesn't move anywhere, it's sink down and up. Use the chair to help yourself get back up. So we're going to come down and up, down and up. We're looking for about 10 on each side, so you would then step it round, reverse onto the other side. We're going to be dropping down and up. I'm going to bring in just a straightforward pillow here, and I'm going to roll the pillow up, place that between the legs. So I'm going to be working more into the glute muscle, gluteal muscles, and a little bit of the VMO, which is the big teardrop muscle that sits inside the leg. I'm just going to squeeze as tight as I can. Hold that for 1, 2, 3, and then release. Squeeze as tight as you can. Hold for 1, 2, 3, and release. And again, squeeze in as tight as you can. So the focus is the VMO muscle here. This muscle is really important in how the knee tracks. So the knee has to track, keeping the natural alignment between the top of the leg, the thigh bone, and the bottom of the leg, the shin bone. So they've both got to stay in alignment, and they've got to allow the patella to sit in the little patella groove. If we end up with a weak VMO, we can lose the tracking of that knee. So this little exercise is going to help keep that muscle strong and keep the tracking of the knee correct. So just squeeze in as hard as you can. Again, we'll probably look to repeat about 10 times. We can keep this little pillow here. And the last one I'm going to do is one called wall squats. But put this pillow between the knee again, similar exercise to there. I'm going to drop down, and as I come down, squeeze the legs together, push back up. Drop down, squeeze the knees together, push back up. So come back down, squeeze the knees together, push back up. So that's a series of reasonably simple exercises you can do at home. As I say, the main focus is for people who are awaiting a knee replacement. So you want to keep those muscles as strong as possible. If you've had a knee replacement, then it's getting those muscles back up to strength again. If you've just got knee pain, you're not going to do any harm in strengthening those muscles. The worst thing you can do is just allow the pain to persist and avoid doing exercise and keeping the muscles strong. You've got to try and keep those muscles as strong as possible so the function of the knee remains as stable as possible. If you let the muscles deteriorate, then the function of the knee is just going to become worse and worse. We will look later on at specific exercises